Glaucomatocyclitic crisis, pretty uncommon disease, but it's important that you recognize it when you see it. Also known as Posner-Schlossman syndrome, after the two physicians who described this in the late 1940s, and really an interesting paper because their paper describes the disease so precisely. It's an uncommon condition characterized by bouts of very high pressures in the face of very mild symptoms and only mildly inflamed eyes. Almost always unilateral, but some bilateral cases have been reported. Typically, these are middle-aged patients. The pathophysiology of this disease is unknown. There is some suggestion that it may be related to herpes simplex, and some cases of cytomegalovirus inflammation have been erroneously called glaucomatocyclitic crisis. And I think as you deal with patients who have diseases like this and Fuchs' heterochromic iridocyclitis and others, you need to recognize that they're sort of diagnoses of exclusion, that lots of inflammatory diseases can overlap with the similar clinical picture. They might have some mild haze from edema if the pressures are very high. But the thing that's most striking about these eyes is that they are remarkably comfortable for the degree of pressure elevation. So this is a lady who I saw as a fellow whose pressure was in the high 50s on her right eye. And you can see that she's a little bit injected over there, but relatively asymptomatic. One can have a few fine choriatic precipitates with very minimal cell. So you can see this little sentinel KP here. And in this movie of a patient whose eye looks really pretty quiet, his pressures were very high, cornea is fairly clear. I'm just trying to find a KP for you. It's very subtle, and you really need to scour the corneal endothelium carefully. And what you'll see right here is a little choriatic precipitate. There's only one in this patient's eye, and helped us to make that diagnosis. The angles are open. There are no synechia. These patients can have hypochromia, just like in Fuchs' heterochromic iridocyclitis. Up to 40% of them, their iris color may be lighter than the other side, and that's really true of all inflammatory sorts of glaucoma. They're treated with aqueous suppressants and topical steroids during the episodes. So unlike Fuchs, where we don't use steroids, we do use steroids here, and we do use them over a short course. Using long-term anti-inflammatory therapy has not been shown to be helpful. Their course is intermittent episodes, and they may be unaware that they're having an episode. And while some of the books will say that this is a relatively self-limited and benign disease, at least in my practice, I have definitely had to do trabeculectomies on people with glaucomatocyclitic crisis because they have had enough episodes with enough elevation in intraocular pressure to cause significant optic nerve head damage. So this is a rare unilateral glaucoma, rarely bilateral, characterized by intermittent bouts of very high intraocular pressures, relatively asymptomatic given the height of the pressure elevation. And this is really part of the problem with this disease, is the patients don't know when they're having these episodes. Treated with corticosteroids, unlike Fuchs' heterochromic iridocyclitis, and also treated with aqueous suppressants. Just a disease that you need to be able to identify. It's not common. You may go through a whole career and only see one or two or never see this disease, but you really need to know what it is.